So good afternoon, everyone, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we've had 582,348 confirmed cases, 6,952 new cases, 3,893 people are in the hospital. And sadly, we've crossed the 7,000 mark, and 7,076 people have died in North Carolina. We're sending our prayers to those who've lost loved ones to this virus and to the people who are fighting it now. We've turned the page on a new year, one that we're hoping will bring us better times. But as we know, this virus did not disappear at midnight on December 31st. In fact, in North Carolina, we've seen some of our highest case counts, percent positives, hospitalizations, and ICU bed usage numbers in the past few days. As Secretary Mandy Cohen will show, 96 counties are now labeled as red or orange, meaning critical or substantial virus spread. 96. No matter where you live, work, worship, or play, COVID-19 remains a deadly threat, and we've got to treat it that way. A new highly contagious strand of the virus has been detected in the United States, and we need to act as if it's already here in North Carolina. This should inspire every one of us to double down on safety precautions. Today, I'm extending for 3 weeks the modified stay-at-home order that requires people to be home between 10 p.m. and 5 a.m. Our other strong safety measures will remain in place, including the statewide mask mandate, closure of indoor bars, and limits on mass gatherings and retail establishment capacity. Dr. Cohen will also issue a new secretarial directive to caution in stark terms against leaving your home for any reason other than work, school, healthcare needs, or groceries. Remember, this virus spreads more when you're indoors, and especially if you take off your mask. Simply put, don't go places indoors where people aren't wearing masks. Deciding to stay home or say no to an invitation to get together indoors can be hard, especially with people that we know and trust. But it's necessary to save lives. As we work to prevent the spread of COVID-19, we're also helping local hospitals and health departments to support their vaccine efforts. Getting the vaccine out quickly is the most urgent priority right now, and we'll use everything and everyone needed to get the job done. Secretary Cohen and her department are doing an excellent job onboarding more vaccine providers and coordinating efforts to help prepare those providers to get their supply out efficiently. To support vaccine efforts, I've mobilized the North Carolina National Guard to coordinate with the Department of Health and Human Services and North Carolina Emergency Management. For now, this mobilization includes approximately 50 guardsmen and women, and we'll add more as needed. Some can administer the vaccine. Others will support logistics, planning, and other key functions like helping local health departments and other providers make timely data entry into the state's tracking system. Today, we're concerned about reports that some people have declined to take the vaccine when it's their turn. However, as more people get vaccinated without any serious safety concerns, we believe that many of those who are hesitant will gain confidence. The COVID-19 vaccine is safe and effective. It was approved by an independent advisory board of health experts. It will eventually be our best medical weapon against this deadly pandemic. But as we said, it'll take many months to get there. Until then, we have to follow the data and use our best prevention tools to slow the rapid spread of this virus. Now I'm going to ask Dr. Cohen to share an update on our data and trends, as well as our vaccine rollout efforts.
Thank you, Governor. As you'll see, as we go through this data, there's an alarming amount of virus everywhere in our state. All right, let's dive in and get started. As a reminder, we look at a combination of trend metrics like COVID-like syndromic cases, new cases, positive tests as a percentage of total tests, and hospitalizations. This first graph looks at people who come to the emergency department with COVID-like symptoms. It's our earliest detection mechanism, and you can see when looking at that yellow line that the trend has continued to rapidly increase, and it's at its highest levels since the pandemic began. Next, we look at new cases. This first graph shows you the trajectory of new cases each day since we had our first case back in March. You can see that yellow line has taken a very sharp increase. If we narrow in on this next slide, the trajectory of cases from early November through today, you can see that picture that our cases are trending upward significantly. On the first day of 2021, we hit a record of more than 9,500 reported cases in a single day. We stayed above 9,000 that next day on Saturday. These are already astonishingly high numbers, and we don't think we've even seen the impact fully of the holidays yet. On our next slide, we look at the percent of tests that are positive. This graph also goes back to the beginning of November, and looking at that yellow line, our percent of positive tests has increased over the past 14 days. It's been above 16% for the past 2 days, and today is above 17%. Again, these are our highest rates since starting the pandemic. On our next slide, we look at day-over-day hospitalizations. This graph also starts in early November, and you can see, looking at that yellow line, this trend also continues to significantly increase. We are setting records both with the number of people hospitalized with COVID-19 and the number of people in the intensive care units. We are seeing increases across the state. Hospitals are feeling considerable strain. Many are taking actions to manage capacity, including stopping non-urgent procedures so they can free up staff to take care of COVID patients, opening additional COVID units, and planning a field hospital in the western part of the state. Okay, so in summary, here's where we are. Surveillance data has increased. It gets a red X. North Carolina's trajectory of cases is up. It gets a red X. North Carolina's trajectory and percent of tests returning positive has increased. This also gets a red X. And North Carolina's trajectory of hospitalizations is increasing. Hospitals are feeling the strain, and this is incredibly worrisome, but they are taking more actions to manage capacity. We're not quite at red, but we are past yellow, so this gets an orange warning sign today. Now that we've taken a look at our statewide metrics, let's see what's happening in our counties. As a reminder, the COVID-19 County Alert System uses a combination of 3 metrics to categorize counties: case rate per 100,000 people over 14 days, percent of tests that are positive, and a composite hospital impact score. Using these metrics, we categorize counties into 3 colored tiers to describe their level of viral spread and healthcare capacity impact. Red is critical, orange substantial, yellow significant. And on this slide, we show an updated county alert map. As you can see, almost the whole state is red. We now have 84 counties in the red at critical levels of viral spread. In our last report just 2 weeks ago, we were at 65 counties in the red. In addition, there are another 12 counties that are now in the orange with substantial levels of viral spread. And as the governor said, that means 96% of our counties in North Carolina are red and orange, with only the remaining 4 in yellow still having significant viral spread. On this last slide here, you can see how quickly things can escalate. That first map at the top is just 1 month ago. As you can see from the map on the bottom, our state is now mostly red. You can see in the data that I just shared that we are in a very dangerous position. Given this high level of viral spread across the state, today I am issuing a secretarial directive on immediate actions North Carolinians need to take to save lives and slow the spread of the virus. First, you should stay home and only leave your home for essential activities, such as going to work or school, for health care, to care for a family member, or buy food. If you're over 65 or at high risk for developing serious illness, use delivery services or alternative pickup methods for food and retail. Second, do not gather with people that you do not live with. Do not go to another person's home indoors, and do not have others over to your home indoors. When you do leave home for essential activities, always wear a mask and keep distance from people. COVID-19 is highly contagious, and more than half of North Carolinians are at high risk for serious illness. Given the level of high viral spread, there is a high risk that you have COVID right now and don't know it. As recommended by the White House Coronavirus Task Force, assume that you became infected with COVID-19 and get tested if you have gathered with people that you do not live with. In addition to the 3 W's, we do have a new tool to combat this virus: vaccines. Over the next week, local health departments and hospitals will begin offering vaccines to anyone 75 years and older. Some counties have already started, and some are still vaccinating healthcare workers and will move on shortly. Remember, vaccine supplies are very limited, and people may need to have to wait. Because supplies are limited right now, most doctors cannot provide vaccines in their office. Your local health department or hospital can help you get your shot if you are over 75. Our website, yourspotyourshot.nc.gov, has contact information for local vaccine providers. We're also setting up a toll-free number to help people know how to find out where to get their shot. While supplies are very limited, the ones we do have must get into people as fast as possible. Most hospitals and local health departments received vaccine just over 2 weeks ago, and they continue to ramp up their operations as they handle vaccine distribution. We sent out new guidance yesterday to all vaccine providers to help them administer shots more quickly. And the governor, as he mentioned, has mobilized the National Guard to help local health departments that need it. Moving forward, the state will modify vaccine allocations to hospitals and local health department based on the number of vaccines that they report giving. At the same time, we're hearing reports of people who have declined to receive the vaccine when it is their turn. And it's important to hear their concerns and then share accurate information about this vaccine. We need to understand these vaccines are built upon years of work to develop vaccines for similar viruses. Like all vaccines, they were rigorously tested for safety and effectiveness. More than 70,000 people volunteered in clinical trials for the 2 vaccines to make sure that they were safe and that they worked to prevent COVID-19. And to date, these vaccines are 95% effective in preventing COVID-19. You cannot get COVID-19 from the vaccine. You may have temporary reactions like a sore arm or headache or feeling tired or achy for a day or 2 after receiving the vaccine. And remember, it will take many months to vaccinate everyone who wants it. Until then, I don't want to lose any more North Carolinians to this pandemic. So let's do all we can today to keep people from getting sick, save lives, and make sure our hospitals can care for people, whether it's for a heart attack or a car accident or COVID-19. Keep wearing a mask, waiting apart, and washing your hands frequently. And whatever your reason, get behind the mask. Thank you.
Thank you, Dr. Cohen. The numbers paint a dark and difficult picture. COVID-19 continues to spread rapidly. We are at a critical point in our fight against this virus. All of us need to take stock of our own actions and pay close attention to the modified stay-at-home order and Dr. Cohen's secretarial directive. Helping health departments, hospitals, and other healthcare providers now will make a difference as the state continues to get more vaccine. But until there's enough supply to vaccinate most of the state, then prevention is our best weapon. With hospitals feeling the strain and more people sick, there has never been a more important time to take this seriously. I'm sure many of us spent recent days and the New Year's holiday thinking about how we've been fighting this pandemic for nearly an entire year. It's tiring, it's frustrating, and we're all longing for the way that things used to be. But if we wear our masks and avoid risky activities, we'll get to the other side faster. Let's work together and rise to this challenge together. Also with me today, North Carolina National Guard Adjutant General Todd Hunt, Secretary of Public Safety Eric Hooks, Director of Emergency Management Mike Sprayberry, and Commissioner of Prisons Todd Ishii. Monica McGee and Mark Lineberger are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We'll now take questions from the media, and if you can identify yourself and your organization, we'll take the first one.
Our first question is from Nikki Hauser with WITN.
Hi, Governor. I just wanted to check in with you about the certification vote today in Congress, actually, and the large group of members deciding to object to those election results. I wanted to ask, how are you reacting to that action being taken?
Well, I have been working here at the Emergency Operations Center all morning. Obviously, the Constitution is pretty clear. The states have made clear their preferences, and I feel pretty confident that Congress will accept those election results today.
Next question, please.
Our next question is from Haley Fixler with Fox 8.
Thanks so much for taking my call. So I have two questions. One is, other states are training other people to give the COVID vaccine. In Florida, they're training firefighters and EMTs to give the vaccine so that more people can give it out and more people can get it. Is that something that we are looking at here? Also, regarding to school reopening, I know that we've mentioned before that each county should make their own decisions about reopening schools. We're now at the highest positivity rate. People are now saying now is the time to make a uniform decision on school reopening. What are your thoughts on that?
Well, first, we want to make sure that we get these vaccines out as effectively and efficiently as possible, and to do it quickly. It is a top priority for this administration, and we'll use every personnel that we can get in order to do this. Dr. Cohen's team is putting a plan in place, or has a plan in place already, that's helping local providers with this vaccine, and I'm going to let her talk about that. Secondly, you talk about schools. We have not heard from superintendents that they want us to take away options for them. You know, we still want our children at school as much as they can be, and to make sure that they are there safely. But we know that there are areas where they want to make decisions to go all remote, or to do partially in person and partially remote. And at this point, we're leaving that option for schools. I'll let Dr. Cohen talk about both of those if she wants to.
Thanks, Governor. As far as personnel to actually administer the vaccines, remember, we are still at limited number of doses, but we all share that sense of urgency of wanting to get those doses we have into those who are prioritized as quickly as possible. And I know that our hospitals and our local health departments are working to do that as quickly as possible. Many are running very fast, and we want to support them to run even faster. And so working with them to understand how they can scale up even the operations they have. For those local health departments that need further assistance, I appreciate the National Guard, who's been working with us since the beginning of this pandemic in many ways to support our efforts, continue to do that as we move into this next phase of work with the vaccine. So I'm appreciative of that, and they will be supporting our local health departments in a variety of ways. We are continuing to onboard new vaccinators. With the next group coming on are our federally qualified health centers. I think that will be another opportunity and another access point for folks across North Carolina as we move into further phases. And again, as we get more vaccine and want to have it in more access points, that is when we will get into training additional folks to be able to administer the vaccine as we go. Thank you.
Thank you. Next question, please.
Our next question is from Courtney Cole with WBTV.
Thank you for taking my question. This one is for General Hunt. Just curious. I know that everything is still in the planning stages right now with the National Guard, but how exactly will they be working with these health departments and vaccination sites to get those vaccines out efficiently and in a timely manner?
I'll recognize General Todd Hunt. General?
Thank you, Governor, and thank you for the question as well. Before I get started, though, I want to also recognize the dedication and service of our soldiers and airmen throughout the National Guard. Like Dr. Cohen said just a few minutes ago, we've been supporting COVID operations since the 6th of March, basically testing almost 55,000 citizens and delivering over 7 million meals. So we are fully engaged in this operation. The COVID vaccine part is just another mission of our mission set that we are planning. We've been planning this for a pretty good while. So to answer your question specifically, the 6-man teams we have are going to have 2 personnel that can do vaccinations, and the rest will be logistics or administrative support, which is what we're getting from the locals' health departments. And those teams are very flexible. They're highly mobile, so depending on what the situation is, they can ramp up or ramp down, and they can go anywhere within the state based upon the state's needs. So that's the answer to your question, I believe. Thank you.
Thank you. We're grateful. Thank you, General Hunt. We're grateful for the men and women who step up and serve in the National Guard and for their expertise and versatility in so many different areas. And it's good to have you working so hard in this arena. Next question, please.
Our next question is from Richard Craver with the Winston-Salem Journal.
Yes, Governor, this is Richard Craver with the Winston-Salem Journal. I had a question for yourself and then one for Secretary Cohen. I guess when you're talking about the extension of the curfew and the recommendation about people not leaving home, how does that play into the schools in terms of parents being able to get their children to school and home from school, or riding the bus and not riding the bus? And then the second question is I was going to get the Secretary to elaborate on her concerns about long-term care facility workers not taking the vaccine.
Well, in answer to your first question, we want to make sure that that people are moving forward to do the things that they need to do to make sure that the vaccine is administered appropriately. But we also need to make sure that people are taking prevention efforts to slow the spread of the vaccine. The secretarial directive gives some stark warnings to people, and we want to remind everyone that you need to take these steps in order to protect yourself and your family. So her directive is advisory to people, but we still have this executive order in place that is mandatory. And we just want to make sure that people understand how serious this is and that people really need to step up and make those sacrifices about not visiting your friends, about not going into places where people aren't wearing masks, particularly indoors. And we've got to get that message out strong because we know that more and more people are getting sick and dying, that our hospitals are nearing capacity. And it's also making us push hard on this vaccine distribution and making sure vaccines get in people's arms. The problem with relying on vaccines, though, is that it'll be months and months before we get enough supply to get enough people vaccinated to create the immunity that we need. So as we enter into these few months while we're working on getting this vaccine to people, you got to pay attention to protecting yourself and your family and others. And that means really stepping it up to a level where we haven't been before. And that means working very hard to avoid contact with people when you don't need to. You mentioned getting children in school to school. School is an exception, both in the executive order and her directive. And remember, that has been a primary objective for us, to have children in schools. So that's an exception to both. But I'll let Dr. Cohen address both of those.
Hi, Richard. So in the secretarial directive, where we want folks to stay home unless leaving for an essential activity, work and school are considered those essential activities, but to really limit any other reason to be leaving your home beyond that. And as far as vaccine and hesitancy, I think this is something we saw coming, we have been thinking about for a very long time, particularly working with our advocacy partners and our historically marginalized populations for a very long time to try to understand this. And we have to really make sure that we understand that there are real reasons for folks to be hesitant. I think we need to hear those concerns, and then it is our job to provide good, accurate, scientific information about these vaccines. We want folks to know that they were rigorously tested, that it built on years of work to get these vaccines, that they are 95% effective, that there were thousands and thousands of folks in these clinical trials, that you can't get COVID from the vaccine. I think these are all really important things for folks to hear. I think now that we've had more than 100,000 people in North Carolina vaccinated with these two vaccines, we've had as the governor mentioned in his remarks, we've had no serious safety concerns from the vaccines. I think folks will start to see that this vaccine it continues, and they see their peers. It is safe and it is effective. And so we hope that folks will learn more about this vaccine. And I think it's incumbent on us and our partners in the media to be able to continue to share these messages. But importantly, to work with our community members. I think we want to make sure folks hear from those that they trust, those that they know, whether it's in the faith community, the medical community, or others, to get good information about this. This is why partnership in this is going to be so important. Thanks, Richard.
Richard, also, we're working to get people who are in our communities to publicly take the vaccine, particularly people who are known and trusted. In many communities of color, people have historical concerns and skepticism about the vaccine that can be understandable, but a lot of community leaders of color and pastors and elected officials and others are stepping up, as long as they fit into the category, to show publicly that they are taking the vaccine. Governor Hunt and former First Lady Carolyn Hunt had their vaccine publicly, I think yesterday or today. So we're doing that to show people that this vaccine is safe and very effective, and even higher effective rate than the health experts thought possible. And we're going to continue to work really hard to convince people that this is something that's important for them to do. And I hope as things go along that people will become more understanding and will go ahead and take this vaccine in order to save their lives, lives of their family, and people that they're around. Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. Are you confident there's now the structure in place for the vaccination plan so there aren't any gaps in giving them out if we end up with more than we think is coming this week or the next week? And is there what's needed beyond the National Guard to help get those shots out? And if not enough people are going to take the ones that they're offered in a certain phase, are they ready to go for the next subset phase? So they're not sitting around going wasted.
Dr. Cohen addressed this specifically, but she knows that this is the top priority of the state right now. And they have been working with local health departments, with hospitals, with other medical providers to make sure they know about the priority categories, to make sure they know about putting the data in the database, to make sure they know the guidelines on how to give the vaccine. And they know that they have at their fingertips the ability to mobilize a lot of people to do this. And I'll let Dr. Cohen talk a little bit specifically about what the plan in place is. I have confidence in it, yes.
Hi, Dawn. There's a number of things that we're doing to make sure that we don't have vaccine sitting around. We all share that sense of urgency to make sure we get out vaccine as quickly as possible. Now, the state has allocated all of the vaccine that has come to us from the federal government. We prioritize getting that into all 100 counties. So there is an access point in every single county in North Carolina. And now we know that there are some folks who have run fast and are using up all that vaccine that they're doing. We know others are still improving their operations, and we are already seeing that speed up over the course of this week. So as we head into this first group of those that are 75 and older, we are definitely seeing more vaccine happening, but we want to support folks across the board from the state level. So sometimes that, like as you've been hearing about, is the National Guard being deployed to support some of our efforts in our local health departments. Everything from vaccinators to IT support, data entry, logistics. Sometimes that's guidance from us on best practices on how to make sure that we can speed up vaccinations. How do you make sure we can take appointments and have good flow of folks through each of these vaccine events? And then it is also working with some of our partners who know how to scale up even to larger type, higher throughput vaccination events. So all of those things together, I think, are the ways in which we'll move forward. And we will also use the data that's coming back to us at the state to understand and make sure that vaccine is moving around appropriately to our state. We still want to have access points across our state, but we certainly want to be not having any vaccine built up on the shelf. So if folks aren't able to get out vaccine fast enough, we will send it to others that are able to get it out quicker. Thank you.
And Dawn, one thing Dr. Cohen's team has done has asked local health departments, and you particularly worry about this in rural areas, what they need in order to get this done. And we've coordinated the effort. Our emergency management, the EOC here has worked with local emergency management operations in all of the counties and have notified them that we want them to be available to help local health departments. And already in counties, some of the counties have just used up their vaccine supply just like that because they are ready to do it, and they've got teams there to help them with logistics, to help them make appointments, answer the phone. And I got to give a shout out to all these healthcare workers, people in local health departments in these hospitals who have been working day in and day out for the last 10 months dealing with people with COVID and taking care of them. And now we're asking them also to put this vaccine into people's arms. And they are ready to do it. And we want to provide, and I know the department and our emergency management, National Guard want to provide all of the help that they need to make sure they get the job done. Next question, please.
Follow up, Dawn Vaughn, News and Observer.
Hi, thanks for the follow-up. Myself, and I'm sure plenty of other reporters, are being asked, inundated with questions from people who want to know how and when to get their shot and where do they go. So I know this has already started with one location, but when will there be multiple large, like PNC arena style places where people can go get vaccinated? And then when they do open at that capacity, what is North Carolina doing to avoid what you see in Florida with the overnight waiting and lines of cars and everything?
Address it.
Thanks, Dawn. So right now, if you are over 75, we encourage you to call your local health department or your local hospital. Those are our vaccinators at this point. As I was mentioning, we are working with a couple of sites so that they can scale up sort of higher throughput vaccination sites. So stay tuned for more on that. We've stood up a 1-800 number. We have our new website that can also help folks know where they can get their vaccine. But again, we're just focused on those who are over 75. But we know this is going to be a team effort here in North Carolina. We at the state want to support our local health departments and hospitals, but we know that the folks who are over 75, they may need help getting a ride to their vaccine appointment. So we know that we want to involve everyone in this activity because we want to protect each other. So we all feel that sense of urgency. I think we all know that we're going to work together as North Carolinians to make sure we can get folks vaccinated as quickly as possible. But I want to remind everyone, vaccine supply is limited. So really this is going to be a number of months that we're going to be doing these vaccinations until we're able to get vaccine available to everybody. Thanks.
And to just make sure everybody understands, it's 75 and older. So if you are 75 years old or older, then you are number 2 on the list. A number of the counties have already started on 75 and older. Some of the counties are still working on the first stage of healthcare workers who are working immediately with COVID patients. So I know that they're going to continue to work to make sure that areas of the state get this vaccine and provide them the assistance that they need to get it out. Next question, please.
Our next question is from Jason DeBruin with WUNC.
Hi, thanks for the question. This is Jason DeBruin, North Carolina Public Radio. First of all, thank you for the information you sent last night. It's a lot of good detail. It does show that North Carolina has received a good bit more doses of vaccine than we've been able to get into people's arms. I know that there are a number of different reasons for this, but I wonder if you might address what the main bottleneck is for getting the doses, out of the UPS box, so to speak, and into people's arms.
Reiterate that this is our top priority, and we're dedicating whatever personnel and assistance that we need to get this done, and that a number of areas of the state where vaccine has been given, they've already used it up. And I'll let Dr. Cohen talk a little bit more about that.
Hi, Jason. Thanks for the question. And I think as you see, and you can see in North Carolina in comparison to other states, I think everyone is working hard to ramp up their operations. Again, we're just a couple of weeks into this. And of course, this happened over the holidays. So I think folks are hitting their stride now and figuring out their operations. Some are doing terrific and have been running fast. Others need support, as the governor said. And there's a myriad of kinds of support that they need. Some they need vaccinators. Some they just need back-end support on their IT systems or data entry, or they just need help answering the phones to make appointments. So we want to provide whatever help that we can as we scale up our activities here. So the myriad of reasons, again, I think everyone shares that sense of urgency, is working hard, and our job at the state is to support them in the hard work that they're doing and to make sure we can get vaccine to folks as quickly as possible.
Thanks. Next question, please.
Our next question is from Michael Hyland with CBS 17.
Hi, this is Michael Hyland from CBS 17. As I understand, the National Guard had indicated they've been doing some planning for the vaccination assistance for a couple of months now. Why are they only being activated for this purpose now and not when the vaccination effort actually began, when the vaccines arrived here?
Actually, I activated the National Guard when this thing started back in March, and they have been doing all kinds of jobs related to this pandemic, whether it's helping with testing and logistics, whether it's getting food out, helping food banks and schools get meals to children. And now that the vaccine is here, they have been planning to help with this, and I've issued the directive to mobilize them to do it. So they are ready to do it, and already we've got 50 of them working on it. So these things have been planned ahead of time, and now we are providing the assistance to the different health departments and facilities that need the help. Next question, please.
Follow-up, Michael Hyland, CBS 17.
I also have a question related to the directive that Dr. Cohen has issued. Several elements of it are very similar to the initial stay-at-home order back in the spring. So why not take that step at this point and make it an order?
Thanks, Michael. You know, throughout this pandemic, we've known that this isn't about a police officer showing up at your home. This is about us taking the individual responsibility to slow the spread of this virus. And I think this secretarial order lays out in very stark detail immediate actions that folks can take and how to protect themselves, their family members, their friends, their community. So we knew this wasn't about police showing up at someone's home, but really about being excessively clear about what I and my colleagues at the department think it takes to protect everyone at this moment in time. I think you saw with the stark data that we presented today, there is so much virus here in North Carolina, and I am very, very worried. So I want everyone to be protecting themselves and others. You know, I think it's really important to remember you could have COVID right now and not know it. And you don't want to be spreading that to others who could be at higher risk because of their age or underlying medical conditions. So please do take that care to stay home and not leave your home other than for essential activities like work, going to get health care, going to school, getting groceries. And if you are over 65, please consider using delivery services. Call a local member of your church and ask if they could go shopping for you. Really, we need to be protecting each other, helping each other out. And I've seen North Carolinians do this over and over and over the last year, but we need to really pull together as a state, given what we're seeing in our numbers. Thanks.
Next question, please.
Our next question is from Michael Perchik, WTVD.
Good afternoon. Thank you so much for your time this afternoon. We had lower metrics back in the spring, yet more stringent restrictions. As we continue to see these record-breaking case counts and positivity rates, have there been any internal discussions among state health leaders about the implementation of further limitations?
Yes, there have been. And let's take stock of where we are right now. We have a mandatory mask order, which is one of the strongest in the country. We have closed indoor bars. We have severely limited mass gatherings. And we put significant restrictions on gyms and exercise places and requiring masks all the time in those places, and have restricted capacity for indoor dining and retail establishments. So there is a lot out there, and there's work to enforce that. I've been encouraging law enforcement and local governments to help us enforce that, and if we could get everybody abiding by those rules, I think we would be in much better shape. But I want to tell you that all options remain on the table. We thought it was important for Secretary Cohen to talk to people about not doing the things that you really don't have to do, particularly when you're going to come in contact with other people, and particularly when you don't wear masks. All options, however, will remain on the table. I'll say one more time, too, in talking with those healthcare leaders, they are managing their hospital space, their ICU space. It's getting tougher and tougher, but they are working very hard to do it. They learned a lot at the first of the year when we first dealt with this pandemic, and I think that they're doing a good job of this now. But all options remain on the table, and we're going to put health and safety number one. Do you want to add something? Okay. Next question, please.
Follow-up, Michael Perchik, WTVD.
Thank you for that, Governor. And this follow-up is for either you or Dr. Cohen. As Dr. Cohen mentioned, hospitals are feeling considerable strain, and health officials do not believe that we have seen the full impact of holiday travel yet. After we saw what happened in December, likely stemming from Thanksgiving travel, with those metrics sharply increasing, are you confident that hospitals are prepared to handle further surge over the next couple of weeks?
Let Dr. Cohen address that.
Hi, Michael. Thanks for the question. And I want to commend our frontline healthcare workers and our hospitals that have really shown a tremendous amount of collaboration. I frankly, unprecedented level of collaboration through this pandemic. We've learned a lot and, frankly, built an infrastructure over nearly a year to be able to respond to this pandemic. And I think they're doing all the things necessary to make sure that we can maintain capacity over a period of time. But what they're doing is that means that they are decreasing the number of elective or non-urgent procedures or surgeries that they're doing so that they can take the staff that would normally work on those surgeries and move them over to care for COVID patients. They're changing over units that would have normally been for non-COVID patients and now taking on more COVID patients. They're seeing their ICUs need to expand into other areas of their hospitals. They're needing to move staff around from one type of work to another. They're needing to make major adjustments to how they operate, but they're doing it. They're collaborating, they're moving patients around, and they're working closely with us at the state. I think our teams are in nearly constant touch about what's happening, and we want to support them, whether it's with equipment or personnel and patient movement. So I think everyone's doing all that they can. But I think we have a major challenge ahead of us, and I think that's exactly why we issued the secretarial directive today. We all need to work hard to protect each other, our families, ourselves, and that's why we want to make sure we're laying out in very clear terms that we think that folks should stay home other than for essential reasons. If you have to go out, you must wear a mask. This is the most worried I have been through this pandemic. I think our hospitals are managing, but it's going to take all of our work to make sure that we don't overwhelm our hospitals. Thank you.
Next question, please.
Our final question is from Brian Anderson with the Associated Press.
Hi, thanks for the question here, Brian Anderson with the AP. And I'm just curious, are you guys considering any financial incentive offerings for vaccine acceptance among North Carolinians? In other words, paying North Carolinians to literally get the vaccine, or are you considering mandating vaccination for nursing home workers as well? And just lastly, is there any statewide standard for the appointment booking process that y'all are considering? Thanks.
We have not put in place any kind of financial incentives or any mandating of the vaccine. We want to try to convince people that it's safe, but there are a lot of people who want it, and it's very limited right now, so we haven't done that. I'll let Dr. Cohen address the other question.
Thanks, Brian. So yes, as the governor said, have not contemplating any sort of financial incentives nor mandates. I think we are focused on making sure we can get good information out to folks so that they can make decisions about the vaccine. I think when they hear the fact that it has been rigorously tested, the fact that it is effective, that is, we are seeing no serious side effects after even 100,000 folks here in North Carolina have been vaccinated. I think those are the messages, as well as seeing their own friends and colleagues and family members get vaccinated. We think all of that is going to help folks feel more comfortable and to make sure that we're reducing that vaccine hesitancy as we go forward. And then in terms of appointments, those are going to be handled by the local health departments and the hospitals themselves. Some of them have extensive appointment systems, particularly the hospitals. A number of local health departments already do that. For those that don't, we have recommended some appointment solutions. And again, they're using a variety of ways to do it. So appointments will be facilitated through the local health departments and hospitals themselves. We do have an 1-800 number to help to make sure that we can answer questions and navigate folks to a vaccine site near them. Thanks.
Thanks everyone for joining us today. Stay safe out there.